Patient history. 26-year-old African-American female patient originally from Louisiana was diagnosed on December 2014 with systemic lupus erythematosus. Since then, the patient has suffered 6 tonic-clonic seizures, anemia, thrombocytopenia, acne vulgaris, Raynaud's phenomenon, alopecia, acute renal failure, chronic kidney failure, hypertension, pericardial effusion, and joint pain. Patient came to Houston to get a second opinion because her primary care physician was not treating her condition and knew she had a problem with her kidney. The patient passed out a week before being admitted. The first priority NANDA for the patient is impaired urinary elimination related to inflammation in the nephrons, secondary to systemic lupus erythematosus, as manifested by a BUN of 71, a serum creatinine of 5.59, urine output less than 400 milliliters in a 24-hour period, and the patient stating that she had difficulty urinating. The short-term goal for this patient will be that she will not have inflammation in the nephrons as manifested by a BUN less than 71 and a creatinine of less than 5.59 in 8 hours. Urine output will be greater than 400 milliliter during a 24-hour period, and that the patient will not have difficulty while attempting to urinate in 4 hours. Interventions for this patient are to instruct the patient to increase fluid intake. This poses risk for metabolic acidosis, especially if the patient is oliguric and not excrete protein in the urine. Another intervention is to administer furosemide to the patient at 900 hours. Loop diuretics are given to control blood pressure and fluid volume. The third intervention is to give the patient methylprednisolone, sodium succinate, solumedrol 400 milligrams in 250 milliliters, dextrose 5% water. The patient is treated with corticosteroids in order to suppress their anti-inflammatory and immunoregulatory properties. Our second nursing diagnosis is fatigue. The patient has fatigue related to physical and psychological anxiety secondary to systemic lupus erythematosus. Patient verbalized a feeling of extreme weakness and has also expressed how it interferes with her daily living activities. Patient's lab values showed low iron saturation of 40 Ug per dl and low hemoglobin level of 8.2. By the end of the shift, the patient will not show signs of fatigue and weakness, and lab values will be within normal levels in 8 hours. For our interventions, the patient will be assisted in developing a schedule for daily activity and rest that will help the patient complete desired activities without adding levels of fatigue. Ferrous sulfate will be administered to support the formation of normal red blood cells. The specific cause for low hemoglobin levels will be assessed that can compromise activity tolerance. Our third NANDA is disturbed body image. As a result of Ms. Smith's condition, she struggles with disturbed body image related to body changes. The patient presents with these manifestations to prove this diagnosis. She marked her acne and dry skin made her not feel good about herself. She stated, "I used to have long, beautiful hair, but now it is so ugly as a result of alopecia leaving patches of scalp hair." As a result of the edema formed on her extremity, she said, "I used to be a model, now I'm really fat." A short-term goal for this patient is that the patient is willing to verbalize concerns in regards to her self-image. A long-term goal for the patient's self-esteem about her body image is that the patient is in acceptance of her self-image. Interventions and rationales. Instruct the patient to clean, dry, and moisturize intact skin and to use unscented lotions. Scented lotions may contain alcohol, which dries the skin. Suggest to the patient several ways to cover her head, such as with the use of scarves or hats. Hair loss may interfere with lifestyle and self-image. Discuss with the patient the effects of the medication she is taking, such as prednisone. Common side effects of steroids include acne, easy bruising, high blood pressure, weight gain, and swollen/puffy face. NANDAs that can apply to lupus are acute pain related to inflammation and tissue damage, chronic pain, impaired skin integrity, disturbed sleep pattern, activity intolerance, self-care deficit, deficient knowledge, impaired comfort, and ineffective coping.
I knew something was wrong. The doctors weren't telling me anything. I can't deal with this anymore.
I'm so tired of watching you so sick. Oh, my poor baby. I'm happy you came to Houston. Now we can get some answers. Hopefully they can help us. I hope they help us out. Hello.
Yes.
Hi, Miss Smith. My
Yes.
name is Alex. I'm your nurse for today.
Okay.
Hi. Are you her family?
Yes, we are. Yes, I'm the mother. She's my daughter.
Nice to meet you. All right, Miss Smith. What was the main reason for your visit to the hospital?
Well, I was diagnosed with my lupus December 2014, and I thought everything was okay. You know, we as a family thought that it was okay, and then I started losing my hair. That's why I had this ugly scarf on, and my face, I had acne, and then I'm engaged. I was supposed to get married. I can't fit my wedding dress. I'm tired all the time. It's just a lot. I have a son, and he has to see me struggle so much. I just can't no more.
I understand. All right. Well,
Can you explain us what is lupus?
Yeah, because she's experiencing a lot of pain. She's a lot
Like,
of
what
stiffness.
exactly? Because there's a lot of things going on with her. We don't know what it is.
of course, lupus.
Lupus is an inflammatory disease that is caused when the immune system attacks its own tissues. The onset of lupus may be acute or insidious. Common manifestations include fatigue, erythematous, butterfly rash, Raynaud's phenomenon, which occurs in 20% of all lupus patients, patchy alopecia, pulmonary abnormalities, cardiac involvement, including pericardial effusion, microscopic hematuria and pyuria, and urine sediment with cellular cast due to glomerular nephritis, possibly progressing to renal failure. Also, there is CNS involvement, which is emotional instability, psychosis, headaches, irritability, and depression. Common lupus complications include, but are not limited to, concomitant infections such as a UTI, renal failure, and osteonecrosis of the hip from long-term steroid use. Lupus is exacerbated by abnormal estrogen level, exposure to sunlight or ultraviolet light, immunizations, physical or mental stress, pregnancy, specifically in the postpartum phase, streptococcal or viral infection, and genes such as a defect in the apoptosis.
Okay, I understand now. Okay, thank you.
Yes. So basically, right now we'll try to focus on managing your pain. And then I'm going to go ahead and perform your head-to-toe assessment and check your vital signs.
Okay.
And then since you're experiencing pain, we can administer some pain medication, and my colleague can do that for you.
Okay.
All right. For your urinary elimination, I saw that your renal function has kind of decreased. When was the last time that you had to go to the restroom to urinate?
I actually tried to go this morning, but it's very hard for me to go. It's not like I'm going on a daily basis. It's very hard for me to go.
Like just a little bit of urine comes
Yes.
out? Okay. And this pain that you're experiencing, describe to me, like, where you're feeling it, the quality.
The pain is just so unbearable. It's my joints, from head to toe. I'm in so much pain. It happens in the morning, all times of the day, and night. So I don't think it's like a certain trigger. It's a sharp pain, then it can be a dull pain. It's just so much pain, and then I could be in so much pain to where I don't want to even move, and I just want to stay in bed all day.
Okay. Okay, so I'm going to begin your head-to-toe assessment, all right? I'm going to take a look at your eyes. I want you to look straight ahead for me,
Okay.
and I'm just going to check your pupils, okay? All right, we're going to do the other side. Same thing, look straight ahead. All right. And let me take a look here. I'm going to listen with my stethoscope
Okay.
to your heart sounds.
Patient presented alert, oriented ×3, skin temperature is dry and warm to the touch, speech is clear, responds to both command and pain, patient is able to perform activities independently, pupils are reactive bilaterally with present periorbital edema, patient is on telemetry, heart rhythms are normal, radial and pedal pulses are normal, edema +1 on right lower extremity. Patient has shortness of breath while walking, clear breath sounds bilaterally, abdomen is firm, distended with bowel sounds present in left upper and lower quadrant. Right upper and lower quadrants absent. Patient complains of abdominal cramping. Patient complains of trouble with urinating. Overall, patient is cooperative and accepts the disease process.
Vital signs, okay?
Okay.
Just to make sure that we're good for the morphine medication
Okay.
and also for other things as well. Okay? Go ahead and pump here. You're going to feel a tight squeeze.
Okay.
The patient's vital signs were as follows.
Okay, so your vital signs are stable. We are going to have another nurse come in and she can administer that pain medication for you. And then also, you're experiencing some nausea, is that right?
Yes.
Okay, so we can have her do that for you as well.
Thank you.
Okay, I'll check back with you later.
Okay.
Thank you.
Yes.
Hi, Mrs. Smith. How are you doing?
I'm good.
My name is Naz. I'm here to start an IV and draw some blood.
Okay.
The doctor has ordered some labs for you so we can see how your kidneys are working right now.
Okay.
And I also give you your morphine. You said
Okay.
you had pain. Can you tell me, rate your pain on a scale of 0 to 10?
Oh, honey, it's a 10.
It's a 10? Okay.
Yes.
And she also told me you had nausea and vomiting.
Yes, I just feel sick.
Okay, so I'll give you your morphine. I'll give you 2 milligrams of morphine.
Okay.
And I'll also give you 2 mLs of Zofran for your nausea. Okay?
Thank you.
All right, so let me just put some gloves on and we'll get started. Okay, so could I see your hand?
Sure.
Can you tell me your name?
My name is Vanessa Smith.
Can you tell me the date of birth?
It's January 16th, 1990.
Okay, so I'm going to start your IV over here.
Okay.
Let's get started. And I'll draw your blood first, and then I'll give you your medications, okay?
Okay.
Okay, so I've given you your medications.
Okay.
I'm going to reassess your pain level in 30 minutes, okay?
Thank
Is there
you.
anything else I can get for you?
Honey, if this, I know you can't do anything about it, but my hair is gone and I have to wear this ugly scarf. And
Well, have you tried using different colored scarves, maybe a patterned scarf, something pretty, maybe a wig?
never thought about that. I think I would like a scarf. I think the wig will irritate me now, but I think probably a more prettier scarf might work. Thank you.
Okay, all right.
The patient was also administered amlodipine because she has hypertension, citrofloxacin as a prophylactic, ferrous sulfate because the patient is anemic, furosemide Lasix because the patient has acute renal failure, mycophenolate because the patient has systemic lupus erythematosus, and it is a suppressant of the inflammatory system, prednisone because the patient has systemic lupus erythematosus, acetaminophen for her headaches, morphine for her joint pain, ondansetron for her nausea, and promethazine for nausea as well. Diagnostic tests. Kidney biopsy is used to determine disease stage and extent of renal involvement. A complete blood count with differential showing anemia and decreased white blood cell count, and there's also a decreased platelet count. Other diagnostic tests includes an ANA and lupus erythematosus cell test showing positive results in active SLE, electrocardiography showing a conduction defect with cardiac involvement or pericarditis, chest x-ray showing pleurisy or lupus pneumonitis. The lab results were as follows. The patient's BUN of 71 dl per ml and creatinine of 5.59 dl per ml indicates kidney failure. Her low hemoglobin of 8.3 Gs per dl and low hematocrit level of 23.4% indicates anemia. Decreased white blood cell count of 2.8 milliliters and a decreased platelet count of 132 cubic millimeters is a result of her mycophenolate mofetil treatment.
Yes.
Hi, Mrs. Smith.
Hello.
How's your pain now?
Oh, I feel so much better, honey.
Doing
Thank
better?
you so much. Thank you.
You're welcome. What about your nausea?
It's gone. Whatever you gave me, honey, worked.
Okay. Your scarf is really nice. I like it. And I like your earrings too. It looks
Thank
really
you.
nice.
It makes me feel a lot prettier about myself. So
That's good.
thank you.
You're welcome.
Miss Smith,
Yes.
my name is Dr. Alexander. I'm your neurologist.
Neurologist?
Yes.
Aren't you
What?
a brain doctor?
Is my baby crazy or something? Why does she need a neurologist?
Oh, well, I'm the neurologist, and yes, we do work with the brain, but we also work with the whole central nervous system. And the part about your disease is that sometimes your disease can affect the central nervous system as well as the brain. I saw that you had a history of seizures as well. So what I want to do is I want to look at I want to order some MRIs, some electrocardiograms, and some maybe
Wow, that's a lot of things going on.
Yeah, well, we need to order all of these tests so that we can attest to the extent of her disease process to see how much her lupus has affected her central nervous system.
Okay.
hmm So we're going to order some CT scans, some MRIs, some electrocardiograms, and some x-rays to see the extent of the damage. Now, I saw in your chart that you have a history of seizures and epilepsies. Can you tell me a little bit about that?
They're so horrible. The seizure happens, and sometimes I don't know what's going on, during or after. They're so aggressive. I'm always tired after the seizure. I don't know how many seizures I had one
It's
time.
like around 6.
Like around 6. So they take a lot out of me, and I don't even know where they're coming from. So.
Okay, so the seizures, headaches, and migraines are all part of the signs and symptoms of your lupus illness. So that's really where that comes from. So now you have an idea about where maybe your seizures and epilepsy are coming from.
I do have a bad headache after every seizure. So. Okay.
So that's what we're going to do. I know this can be a very difficult thing for your family and your friends. And so you're in a good team of nurses and doctors. And so we're going to do all we can to expedite this process and make sure that it goes smoothly. We'll also space out your tests so that way you're not overwhelmed.
Okay, thank you so much.
Thank you so much.
Okay, if you guys have any questions, you can call my extension. It's 2266, and it's also at the nurses station down the hall. And if you need anything else, just call the nurses. They'll be happy to help you.
Thank you.
I'm so glad we came to Houston.
I know, I've seen some improvement in you.
I have.
No matter what, we're always here for you. You know we love you.
I know.
We love
Thank
you.
you. I love you guys too. Yes.
Hi, Ms. Smith.
Yes.
I am Dr. Sosa. I am the nephrologist.
Okay.
I'm sorry.
It's just a fancy word for kidney doctor.
Oh,
Okay, so I got back the results from the biopsy.
Okay.
Okay, so the lupus has reached the kidneys, and I'm sorry, but I am recommending to start dialysis. And dialysis pretty much is just gonna do the function for the kidneys, get you back on track. And I know it's a hard time. I'm gonna get the radiologist to start a vascular access, and I'm also gonna recommend a nutritionist to come in. To change your diet.
Okay, thank you.
I'll leave you alone. I'll send the nurses, okay? Okay, thank you.
Dialysis is the movement of fluid and molecules across a semi-permeable membrane from one compartment to another. Clinically, dialysis is a technique in which substances move from the blood through a semi-permeable membrane and into a dialysis solution. It is used to correct fluid and electrolyte imbalances and remove waste products in kidney failure. There are two methods of dialysis: hemodialysis and peritoneal dialysis.
All these visitors, yes.
Hello, Miss Smith. How are you doing today?
I'm good.
My name is Monica Frias, and I'll be your nutritionist for today.
Okay.
Is this your family?
Yeah,
Hi,
my
yes,
mother and my sister.
Okay, nice to meet y'all. So I just wanted to talk to you about your diet today.
And my diet.
Yes, because of your current kidney functions and your history of hypertension, we're going to have to regulate some of the food you eat.
What do you mean regulate?
By regulate, I mean we're going to have to eat less sodium and more baked goods, something on the healthier side.
But you don't understand. My mama has the best gumbo.
I know. Mama makes a good gumbo. Are you telling me I can't bring her no more home cooked meals?
No, of course you still can. You're just going to have to maybe modify a little bit. Instead of fried, just do more baked goods.
Okay.
And, instead of fried chicken, just maybe do
Just
some
substitute.
rice with fish, healthier things like that.
Okay. Mama could still do a good job, baby. Don't worry.
It's going to be okay. Okay? Alright, so do you need anything else?
No. Do you happen to have a list of maybe what we can eat?
Oh, yes, I sure do. So here is a list of the low sodium food.
Okay.
You and your family can go over it, and if y'all have any questions, y'all can just feel free to ask. Okay, my extension number is with the nurse.
Okay.
Okay, thank you.
Alright, y'all have a good day.
You too.
Thank you.
Hi, Miss Smith.
Hi.
My name is Jaisley. I'm the physical therapist that's going to be working with you today.
Okay.
How are you feeling?
I'm feeling a whole lot better.
Oh,
Thank you.
okay, that's good. So I'm going to be actually teaching you about some exercises that you can do to help you with your, I know you have stiffness, inflammation, some pain, so these should help you with that.
Okay.
You have a lot of joint pain, right?
Yeah, but you said exercises. That's
Uh-huh.
like walking and running and those
No,
kind of exercises.
I know you're really fatigued, so this should help you out, and it's
Okay.
very simple, just range of motion, so just like opening and closing your hands.
Oh, okay.
Simply just lifting your feet, your
Okay.
arms,
Okay.
and there's also isometric exercises, and we'll actually do that one right now.
Okay.
So basically what you're going to do is you're going to keep your joints still,
Okay.
and you're just going to push, you're going to contract your hands,
Okay.
and that should help with your joint pain.
Is there something I can do while watching TV?
Of course, you can
Okay.
do it when you're watching TV.
Okay.
Yeah. So do you have any questions for me?
No, that'll be all.
All
I
right.
can't think of any more.
Okay, well let me know if you do.
Sure.
All right,
Problem.
thank
A lot of visitors. Yes.
Hello. Hi, Miss Smith.
Hi.
How are you
I'm
doing?
doing a lot better. Thank you.
Good to hear. All right. I know you got a lot of information today.
Yes,
Yes,
I do.
yes. It can be overwhelming. So I have some teaching guidelines for you to take home.
Okay.
Let me just go through them real quick before I hand these off to you.
Thank you.
As far as your nutrition, I know the nutritionist came and spoke to you a little bit about that. But just to reiterate, we want to consume foods that are low in protein.
Okay.
So foods such as like baked fish, like salmon or cod, chicken. Those are good foods to supplement instead of like red meats. Foods and low sodium. So I know your mom makes wonderful gumbo. But
Yes,
we should try to, just limit the amount of salt that you add into your gumbo.
Okay, we can do that.
Okay, that's good. Any other foods in general, okay?
Okay.
Because when you have foods that are high with sodium, it causes water retention in your body, which you can probably see that you formed edema
Yes.
and urea in your blood. Okay, so we want to reduce that.
And along with that, we want to make sure you take your iron supplements on time. I know the doctor prescribed for sulfate, so we want to make sure you're taking that on time.
Okay.
And we want to make sure you're adding leafy vegetables to your diet to help.
Okay.
And along with that, we need to make sure you prioritize your daily activities. So give yourself some time to rest between your activities
Okay.
so you're not fatigued and exhausted, okay?
Okay.
Is there any more questions?
Yeah, she has a lot of rashes. Like,
Yes.
what can we do to help her with that?
We want to make sure that you're not staying out in the sun too long because that can exacerbate your symptoms of lupus. So if you do go outside, make sure you cover up, okay?
Yes, use a lot of sunscreen if you do go outside. Also, instead of wearing tight clothing, you want to try like loose fitted tops, sundresses. So we want to promote circulation throughout your body.
Okay.
All right.
Thank you.
You're welcome.
You're welcome. So here are your teaching guidelines. So I'll
Okay.
give that to you,
Mama.
and you can go through that.
Yes, thank you.
You're
welcome.
welcome.
Thank
Thank
you.
you.
Thank you.
Bye. Wow, y'all, I'm so glad we came to Houston.
Yes.
I know what I was eating wrong. I know what I was just doing wrong. I know where my seizures came from. They helped so much.
Yeah,
really.
St. Luke's has treated us really good. They explain a lot of things that we didn't know.
I know, and I'm happy that they gave us the guidelines just in case we can forget. But we are here to help you and we love you. Or make sure you'll follow your diet. Make sure you're not as fatigued as you usually are. So we just want to let you know that we love you.
I love you too.
Evaluation of NANDA number 1, impaired urinary elimination. The goal was not met as the patient did not have a BUN creatinine decrease from previous values and that the patient only urinated 100 ml in less than 8 hours, which over a 24-hour period would only total 300 ml. The only goal criteria that was met was that the patient urinated without complication. Evaluation of NANDA number 2, fatigue. By the end of the shift, the patient stated, "I'm feeling better." However, the patient's iron level was less than 40 UGs per DL and hemoglobin was still less than 8.2 and the goal was not met. Disturbed body image evaluation. Upon evaluation of the patient, she applied lotion on her skin, she was wearing a colorful scarf around her head, and she stated, "I'd rather feel better than look better." Goals were met.